Hi, this is Dr. Seema Kotak, a homeopath, and today I'm going to talk about acid reflux disease, also called as gastroesophageal reflux disorder or GERD. So, what is this condition? Normally, when we eat food, the food goes down from the food pipe into the stomach, and there is a circular band of muscle which is present just at the junction of the lower end of the food pipe and the stomach. Now this particular muscle acts as a valve and allows the food to go down into the stomach, but doesn't allow the food and the acid to come up from the stomach into the food pipe. But in this condition, that muscle doesn't work properly. So the food and the acid comes up from the stomach into the food pipe and irritates that area. So what are the symptoms then in this condition? Most commonly, people come up with a lot of pain in the chest. There can be a lot of burning sensation, nausea, vomiting, too much amount of belching, bloating. There can be a bitter taste in the mouth. Some people have a sensation of a lump in the throat. They have difficulty in swallowing. Some people say they feel as if some food has come up into the chest, into the throat. There are also people who have chronic hoarseness of voice. Some have even their asthmatic symptoms which get aggravated at night. So people come up with a variety of symptoms whenever they have this condition. So now I'll give some tips to help in healing this condition along with homeopathic medicines. So the first tip is to eat smaller and frequent meals. See, whenever we eat too much amount of food at one time, what happens is there is a chance that the food, when the stomach is very full, the food can come up into the esophagus. So when we eat smaller meals and more frequent meals, it would be helping us. The next tip is that we need to sit down, eat slowly and chew the food very well. Then there are certain foods that need to be avoided, like too much amount of tea, coffee, raw onions, tomatoes. These should be avoided as much as possible, or at least cut down on these foods. The next tip is to quit smoking and to quit alcohol if possible. Another tip is that we need to avoid too much amount of fatty, fried and spicy food if this condition is there. Another tip is that after food, it is better to sit upright for some time. So, like preferably have food at least say 3 hours before going off to sleep at night. After dinner, no vigorous exercises. So, maybe a stroll is okay, but no amount of exercise which will have too much amount of, movements where that can trigger the acidity again. Another tip is that it is very nice to elevate the head and the chest more so that there is less amount of or no acid reflux in during the night time. And of course, stress management is very, very necessary and important in all cases whenever there is any amount of acidity. So if you have liked these tips, do follow it and let me know. And until next time, take care.